COIN, Community-Oriented Integration Network, is a network of friends, people of experience, who explore how to develop local communities for health, compassionate communities. Community-oriented integrated practice means the practice of community-oriented integration. Now, practice means thinking and acting for health and care, not just doing and not just theorizing, but thinking and acting. So it's a process of learning, so that's the practice. Integration means coming together. Now, of course, this can be a hard system like railway lines, or it can be a learning system where people come together in order to learn from each other, share ideas, like a party or a football match even. This comes in some ways from the ideas of Peter Checkland, who wrote this book, which distinguishes between hard systems and soft systems. Look, we need both. It's not really a new idea. The trouble is that medicine and other aspects of health think differently. This was acknowledged in 1978 when the Alma-Ata Agreement was signed by 134 different countries, saying that health is more than disease and health is everyone's concern. It was put very well in this book by John MacDonald, Primary Healthcare Medicine in Its Place. In this book he says, look, doctors are trained in an engineering model of health and care. They look for discrete parts, like the bolts and nuts of a machine. The more organic and co-evolving aspects are not inside that way of thinking. So we have a dilemma. We either say, well, doctors are just part of this and they've got to take their place accordingly, or doctors have to train their minds differently to see that their discrete interventions are only part of bigger stories. In the network that I belong to, COIN, we want the latter. We don't want medicine to go away into its own area. We don't want medicine to be dismissed. We want it to find its place inside a human system for health and care. So we've teamed up with this journal, the Journal of Holistic Healthcare and Integrative Medicine, in which we intend to portray the science, the references, the evidence around what we're putting forward. And each of these blogs will become, in a way, a part of a virtual book being written over a period of time to show the different areas of it. One aspect is in this particular issue, which is spring 2024, shows, for example, the need for everyone to escape from the chaos of everyday life every so often, to go under an umbrella where they can feel safe to stand back and look at what they've been doing with other people of different disciplines and backgrounds, so they can have their minds opened to different things. And then, of course, they have to go back into the chaos until the next time to come out and safeguard themselves, their minds, the madness of the world, under another umbrella. Now, we're not talking about one big umbrella and one big workplace. We're talking about this happening everywhere. I mean, every time we go to bed at night, we're going in under umbrella. Every time we go away on holiday, we are. But we're talking about institutionalizing this process of standing back, thinking about the bigger picture, coming into focused detail as a way of thinking that pervades all of medicine, all of healthcare, and who knows, all of society. Now, in this same issue, the spring 2024, is a lovely paper by Nigel Crisp. Nigel used to be the Chief Executive of the National Health Service, and he's also got a background in social work and voluntary work, particularly in Africa. And he wrote this beautiful book here, Health is Made at Home, Hospitals Are for Repairs. And in a way, he's capturing there you can see by all the frills inside it how many pages I've numbered in my copy. He's capturing here the difference between focused, targeted action to treat a definite problem and the broader aspect of flourishing. We, as human beings, as healthcare workers, need to be able to do this all the time with everything we do. putting them into boxes is the wrong thing to do. So that's what community-oriented integrated practice is about. It's the science of the practice of integration of all things for health and care at local level.